This presentation will cover the exploration of the association between back pain and physical activity. It is presented by Ellie Rohan, Rhianna Quinn, Shari Johnson-Beale, Travis Moriki, Ashlyn Condullas, Kate Draper and Levan de Buisson.
Back pain, particularly lower back pain, has a concerning prevalence on a global scale. To counteract this, physical activity has been described as a main rehabilitation objective for individuals experiencing acute or chronic back pain. However, contradicting findings state both high-intensity physical activity and a lack of physical activity may increase the risk of developing back pain. When considering the impact back pain has on physical activity, an array of facilitators and barriers to exercise have been recognised, such as a fear of worsening pain. Therefore, the multifaceted relationship between back pain and participation in physical activity has formed a foundation to quantitatively examine the same association in university students. Likewise, qualitative exploration of the attitudes towards physical activity among students experiencing back pain facilitates thematic analysis of potential patterns and explanation of quantitative findings. The aim of the study is to identify if experiencing back pain influences participation in physical activity in university students, as well as explore the attitudes towards physical activity within this demographic. It is hypothesised that back pain will impact the frequency of exercise per week in students currently studying HS2405 or HS2401 at James Cook University. This study was a mixed methods analytical design with an explanatory approach to identify how back pain influences participation in physical activity. This study incorporated quantitative and qualitative data through a self-completed survey and interviews. This provided a comprehensive view of the exercise regimes and back pain exposure of university students. The quantitative data determined the relationships between students' physical activity and back pain, while the qualitative data explored the attitudes and beliefs regarding back pain and physical activity. The target population of this study was university students. The actual population of the study was the 116 students enrolled in HS2405 and HS3401 at James Cook University in 2020. The sample population was the 43 students that participated in the surveys and interviews. The recruitment of participants began on the 6th of April. The survey link was posted on LearnJCU. 43 students participated in the survey from a cohort of 116. This is a form of convenient sampling due to the easy accessibility of participants. The sample population for the qualitative research was 10 students selected from the 43 that completed the survey. Inclusion criteria for this study for both the quantitative and qualitative aspects included 1. Being enrolled in HS2405 or HS3401 and 2. Consented to participation. Further exclusion criteria specific to the interviews was those who had not experienced any back pain or injuries. This study required all participants to first complete the research survey, and from these results it was determined who was eligible to participate in interviews based on them providing their email address. These collection methods were time efficient, cost effective, and provided high levels of information and representativeness in a large sample. The quantitative section was completed in the form of a cross-sectional survey. Within the survey, demographic information such as gender, age, and discipline were collected to capture a snapshot of the participant characteristics. It also determined the length of exercise sessions and the amount of sessions undertaken during an average week by students. The survey also included Likert scales used to indicate participants' levels of back pain. All questions were exhaustive and mutually exclusive to ensure the data collected is complete and accurate. The qualitative data was collected in the form of an interview, investigating the knowledge, attitudes, and beliefs about participating in physical activity with or without back pain. 10 interviews were conducted with participants being asked the same 6 questions. An example of the questions can be seen on the screen. All questions were open-ended and neutral, which provided complex responses from all participants. To complete the quantitative data analysis, 2 statistical tests were conducted. A chi-square test measured the relationship between an individual's discipline and whether they experienced back pain. This test was appropriate because 2 categorical nominal variables of discipline and experience of back pain were assessed. Additionally, a manual interview test was conducted to measure the correlation between frequency per week and individual exercise and if they experienced back pain. This was an appropriate test because the dichotomous categorical and numerical variable were being tested. The variable of experiencing back pain is a categorical nominal variable, only including 2 variables. and the variable of frequency per week spent exercising is a discrete numerical variable. To complete the qualitative data analysis, 4 simple steps were completed: data inversion, coding, creating categories, and identifying key themes. For data inversion, the data was analysed using an Excel spreadsheet with 1 question per row and each participant's answer in the next column. Coding the data involved identifying key words from each answer. This was written in the next column. The categories were then created. Responses were then categorised by if they demonstrated whether back pain influenced the participants' engagement in exercise or not. Finally, the key themes were highlighted to identify the correlation between back pain and exercise. Research merit and integrity is evident throughout the project as there was no harm to any participants present. Bias was minimised and scientific dishonesty was avoided in the project by providing the same survey to all participants for the collection of quantitative and qualitative data. The autonomy of participants was considered at all times during the research, whereby the right to make their own decisions towards the study was respected. Beneficence and non-maleficence was practiced simultaneously. The participants were questioned and answered, with the opportunity to withdraw any time. When gaining consent, we inform participants their privacy is important, and they possess the control over the extent of information they share. This information, along with the participant's identity, was kept strictly confidential and anonymous. Additionally, before participants were interviewed, consent was acquired. After collecting survey data, one of the 43 responses was removed, as it was more than 80% incomplete. 8 of the 42 responses were male and 34 were female. 18 to 21-year-olds made up 78.5%, while 22 to 50-year-olds made up the other 21.5%, showing a significant range in age in the participants, as shown in Table 1. Table 3 shows that 50% of participants were from physiotherapy, 35.7% was from occupational therapy, and 14.3% was from speech pathology, with 61.9% of them reporting to have experienced back pain, while 38.1% of participants did not. These demographics allowed for statistical testing to be conducted. Firstly, frequency tables were examined to determine whether one's back pain influenced them to stop exercising. Table 5 shows 7 of the 26 participants ceased exercise, with 19 continuing to partake in physical activity. Table 6 shows that physiotherapy was the most common discipline to experience back pain, however only 2 out of the 16 people stopping exercise after injury. It was also revealed that 4 out of 6 occupational therapy and 1 out of 3 speech pathology students stopped exercise following their injury. The first statistical test compared each discipline and whether they experienced back pain. The chi-squared test was completed and the Fisher's exact test was utilised, as there was 33% of cells expected to be less than 5. There was no significant difference between the discipline and the experiencing of back pain, as P equals 0.084, indicating that there is no relationship between discipline and whether they experience back pain. The second statistical test compared whether back pain affected how many times a week students exercised. The data was tested for normality using the Sharp-No-Wilk test, with the alpha being set to 0.05. As shown in Table 9, P equals 0.08, indicating a significant result, with the data not normally distributed. Knowing this, a Mann-Whitney U test was conducted. The test result of P equals 0.445 indicated an insignificant result, as it was greater than the alpha value of 0.05. Therefore, the Mann-Whitney U test determined there was no significant relationship between experiencing back pain and exercise frequency. 10 participants were asked 6 questions in one-on-one interviews. 9 of these participants experienced back pain and engaged in regular exercise, whilst 1 participant experienced back pain and did not engage in regular exercise. As seen on the thematic map, Figure 1, from the analysis of the data, 4 key themes emerged: perceived back pain, back pain's impact on exercise, perceived influence on exercise participation, and health professional influence on exercise participation. Theme 1, perceived back pain. 1 category emerged for perceived back pain, mild back pain. 4 out of the 10 participants mentioned their back pain was mild. Participants recalled their back pain is due to a sports injury and strained muscle, rather than any serious conditions or injuries. Participant 3 quoted, "I experience back pain infrequently, and it is often after I sit for long periods of time or perform a task that strains my back. It is a mild ache in my lower back." These results demonstrate exercise participation may not be severely impacted due to the mild nature of the pain. Theme 2. Back pain's impact on exercise. 4 categories emerge on the impact back pain has on one's exercise. These include exercise intensity, choice of exercise, severity of back pain, and no impact on exercise. 2 participants stated that back pain affects the intensity of their exercise routines. The intensity of an exercise routine is altered based on the severity of back pain. 3 participants said back pain influenced their choice of exercise to prevent further injury. Participant 6 mentioned it affects your choice of activity and intensity of activity. If I have an acute flare-up, I need to avoid weights for a period of time, or my intensity needs to be dramatically reduced. 4 participants mentioned their exercise routine is affected when they are experiencing severe back pain. Some participants reported flare-ups which are categorized by certain periods where pain becomes more severe. In these cases, their regular exercise routines were affected. Participant 3 quoted the following, "Generally my back pain is mild and it does not influence my normal exercise routine greatly. However, sometimes I will have to stop my exercise before my back pain becomes too severe." 2 participants said back pain did not impact their exercise routines as pain was not severe enough to make alterations. "Had no major impact on my ability to exercise, was still able to function normally," Participant 2 quoted. Only 1 participant recorded back pain being severe enough to prevent participation in exercise. Theme 3. Influence on exercise participation. The 2 categories that influence exercise participation are enjoyment of exercise and strengthening. Enjoyment of exercise encouraged participants to continue with exercise participation. Similarly, participants perceive strengthening to be a motivating factor to continue even though back pain is being experienced. Participant 7 said knowing that strength is the key to stability. "The less exercise I do, the more acute exacerbations I have, so ensuring that I maintain fitness to a degree helps prevent relapse." Theme 4. Health professional influence on exercise participation. 2 categories emerged regarding the influence of a health professional: resting until injury healed and continuing to exercise. 7 participants saw a health professional for their injury. 4 participants were encouraged to rest until their injury healed. 3 were encouraged to continue physical activity. "I went to the physio for treatment. I had to stop exercising for a small period of time, then I could exercise again once I had recovered from my injury," said Participant 3. These results show back pain does influence participation in exercise when absent from exercise is advised by a health professional. So does back pain influence participation in physical activity? Contrary to the hypothesis, most students continue to exercise subsequent to experiencing back pain. Upon qualitative analysis, it was established back pain impacted exercise intensity and the type of exercise, while the severity of back pain was also an indicator for an altered exercise routine. Therefore, further research should focus on specific elements of physical activity. This could be partially explained by the fact that a multitude of studies supports physical activity to support back pain in university students. Combined with the general health benefits and stress-reducing effect of physical activity, it is likely that students feel that it is an advantage to continue despite modifying their normal exercise routine. A chi-squared test assessed the relationship between discipline and prevalence of back pain. P was equal to 0.084, indicating no significant association. A study by Hayes et al. Identified a high prevalence of neck, lower back, and shoulder pain in Australian dental hygiene students. Similarly, medicine students reported self-perceived triggers to back pain, including sitting at university, exam-related stress, improper body posture, and a lack of exercise. This suggested that certain disciplines may experience varying degrees of back pain, so despite finding no significant results within our sample, future research should continue to evaluate the vulnerability of each discipline. This could assist with education regarding back pain, preventative measures within their occupation, and possible strategies to manage existing back pain. A larger sample size would increase the internal validity, while the inclusion of a variety of disciplines would strengthen the external validity by better representation of the population of university students. The number of students who stopped exercising from each discipline was assessed to observe if discipline could be a potential confounder in students' choice to stop or continue exercising. The pie chart displays 64% of the participating occupational therapy students with back pain stopped exercising post-injury and accordingly had the highest frequency of ceasing exercise among disciplines. It must be emphasised that limitations relating to sample size, inconsistencies, and failure to compare to a greater range of disciplines greatly impacts the validity of this trend. Statistical tests should also be conducted to validate findings. A previous study has expressed how current exercise habits and deposing attitudes of students differ, concluding that physiotherapy students score higher in the physical component summary score than social science students. Therefore, further research should aim to understand the impact that area of study has on the attitudes towards exercise and back pain across a range of disciplines. This could strengthen or dispute the weak trend that was found favouring that occupational students are more likely to stop exercising after experiencing back pain. After conducting a Mann-Whitney U-test, no significant relationship was established between the prevalence of back pain and the number of times per week students exercise, as P equals 0.455. This does not consider the intensity or type of exercise being performed, nor does it stratify for severity of back pain, therefore limiting the ability to correlate back pain and its impact on exercise. Given our research question aimed to determine if back pain influenced participation in exercise, this test has opposed our hypothesis and suggested that back pain does not influence whether students choose to exercise. A common theme emerged from the qualitative aspect of the study, signifying many students continue to exercise after back pain due to enjoyment, and the known strengthening benefits which have been linked to injury reduction. External influences such as the advice from a health professional has also been indicative of the choice to stop or continue exercising. This is apparent as 3 of the 7 participants who saw a health professional were encouraged to continue exercising. Future research may benefit from exploring the impact seeing a health professional has on the decision to continue exercise. Various limitations impacted the reliability of this study. Selection bias was present, given the sample included only those enrolled in HS2405 and HS2401, who chose to participate in the survey and interview. Furthermore, only those who experienced back pain were included in the analytical study. This is a poor representation of university students and does not consider the exercise habits of those without back pain, eliminating a possible comparison group. A major limitation of the qualitative aspect of the study was the COVID-19 pandemic, which inhibited the initial proposal to conduct focus groups. Thus, one-on-one interviews were conducted via email, and each group member guided at least one each. The interviews included only 6 questions, which were heterogeneous and rather vague. Accordingly, the ability to use discussion and follow-up questions to expand and facilitate more in-depth responses was diminished, given the nature of delivery. Zoom calls or using the same interviewer each time would have improved this. However, time influenced our decision to continue with email-based interviews with separate interviewers. Recall bias and interview bias was also present due to the retrospective nature of the study design. Due to the restricted nature of the study, a contingency plan was implemented within the survey. In the circumstance that an inadequate sample of students with back pain emerged, participants were also asked if they had ever sustained an exercise-related injury, thus allowing a similar study to be undertaken between injuries and participation in physical activity. However, this was not required. No significant relationship was established between the experience of back pain and one's participation in physical activity. However, thematic analysis of qualitative data suggests that modifications to exercise intensity and type of exercise may occur following back pain. The intensity of back pain was a possible contributor to physical activity participation. Clinically, health professionals would benefit from exploring the principles of exercise that are predominantly affected. It was observed that occupational therapy students are more likely to stop exercising after back pain when compared to physiotherapy and speech pathology students. Further research should amend these limitations and include additional disciplines to compare to. The known postural risk factors of developing back pain are also prevailing among university students. Therefore, students are likely to contribute to the client base of physiotherapists and other health professionals regarding back pain. A further understanding as to whether certain disciplines are more likely to incur back pain and subsequently cease exercise due to predisposed attitudes will contribute to the prognosis of presenting students. Lastly, external influences such as seeing a health professional should be quantitatively measured to understand if this confounding variable has an impact on the decision to continue to or commence physical activity following back pain.
Thank you for listening.